You're listening to Nuestra Gente with Linda Parra.
Good morning, everyone. We want to welcome you to our Mental Health and Recovery Services kickoff celebration for our Issue 3 renewal levy. And this renewal levy will permit us to continue to do the good work that we're doing in Lucas County. I'm Otis Gordon, as already pointed out, pastor of Warren Emmy Church, and I'm really proud and pleased to be able to serve as the chair of this year's levy and the vice chair of the board. I speak today on behalf of the many board members who serve with me, dedicated and volunteering their time and their services to the Mental Health Recovery Services Board. I also speak on behalf of the hundreds of skilled workers in mental health recovery services who do the best that they can to make life better for the citizens of Lucas County.
Thank you for this opportunity to speak. I am a mental health consumer. I am a Unison client. And this tax, which is not a new tax, is a continuation of, I believe I worked on my first one in 1985, and they have all these levies have passed. Lucas County has been very generous in the past. They will continue to be generous in the future. Remember, it's not a new tax, so get out and support this levy.
I'm Reverend Willie Perryman. I pastor the Jerusalem Baptist Church. I'm here in Toledo, Ohio, and I'm also honored to serve as the president of the local chapter of the NAACP, and I am equally honored to serve as co-chair of this campaign, Issue 3. I believe strongly in the work that is being done by the Mental Health and Recovery Services Board. Equity is a public health issue, and so during their annual purchasing and planning process, MHRSB leadership reviewed the format and language provider agency standard contracts to identify those opportunities to advance the goal of eliminating disparities within their system. They understand that this work is always ongoing, but they have made it progress. I am proud as a local pastor. I am proud as the president of the local chapter of the NAACP, and I am certainly proud to be a co-chair and to endorse these efforts. Please vote for Issue 3. It is not a new tax. Thank you.
Good morning, everybody. Dr. John Dvorak. I'm a pediatrician, and like many pediatricians, deal with the many aspects of adolescent and childhood mental health. And proud, really, to be a co-chair and lend my support for this issue. The World Health Organization estimates about 1 out of 7 children 10 to 19 years old have mental health disorder. The National Institute of Health here in the United States estimates over 21% of children 13 to 18 have a mental health disorder. And of the over 22,000 residents of Lucas County who sought treatment for mental health disorders within the last fiscal year, nearly 5,000 of them were under the age of 18. Finally, the board has funded an opiate prevention education, which has been in 60 schools throughout Lucas County, from early childhood through high school. As a physician and an adolescent medicine specialist, I urge your support for this renewal, not new tax. Thank you.
I've probably been involved as a volunteer in the mental health field in this community for half of my life. I started as someone who really had not had a family member directly impacted, and then we had a family member directly impacted. So I got a chance to see firsthand the way this community responds. So we should never lose focus or lose sight about the people issue here. That's what's most important. So clearly we are fiscally responsible. Clearly we are a caring community. Clearly we are delivering a level of service in this community far beyond what the dollars actually buy. Ladies and gentlemen, this community has consistently invested well in mental health and recovery services. It's why we have a program in our community that cares, that is effective and is literally delivering the services that our citizens need. Please support issue 3. Thank you very much.
Thanks to all the speakers. Just want to give a quick reminders. Obviously, not a new tax, issue 3. Remember to vote. We're planning May 3rd. That's all we can control, so we're moving forward just as if we would. Those of you that are agency representatives, again, I want to make a reminder, we have some signs for you. Those of you that have spoken today, our honorary chairs, thank you very much. We want to get a group picture with you before you leave, so please, if you could come on up. Okay, well, we're here today to celebrate kicking off our Issue 3 renewal campaign. It's a mental health board levy for Mental Health and Recovery Services Board. It's not a new tax, and it'll generate about $7.6 million for Lucas County residents to continue to provide mental health and recovery services to individuals in need of care.
The preparation for this levy campaign has been going very great for us. We've been getting great community support. As you can see, our community chairs have been powerful speakers, powerful contributors. So we're just very thankful for the process thus far and very hopeful that we'll have a great election on May 3rd.
I have spent 8 years on the Mental Health and Recovery Services Board prior to now being the honorary chair of this levy, and I know firsthand how hard they work. The staff works, how hard the administration works, how hard they work to make sure that your money goes into the community and goes into services. For every $1 that we get in total expenditures from the board, 94 cents of it goes directly back into programs and into services for all of you. All of raises are capped at 3%. They never go over in raises. We do constantly checks over all of anybody that receives our funds. We do checks of reports. We do comprehensive studies. We make sure things are working. We are not just out here frivolously spending your money. So I hope that everyone comes and votes for issue 3 because it's not a new levy. It's not new monies. It's just taking the existing monies that you've been putting in already and then using them because our people need the services. We need them after COVID. We need services even more for our young kids that have been at home, away from people and developing mental health issues. There's violence that occurs in homes, and so we need to be out there servicing our families with services, counseling, addiction, recovery services. So I urge everybody to go and vote for issue 3 because it's not a new levy.
Being on the board is one of the most rewarding volunteer opportunities I've ever experienced. It's amazing. Mental health is something that's so personal and so sacred in the fact that it still has a lot of myths and stigmas attached to it.
I want to tell you about issue 3. It's not a new tax. It funds over 70 programs in Lucas County and helps so far for 20,000 people. And that's just the start. The reason I'm asking you to support this levy is because what we all want. We want every person, every citizen in Lucas County to have a healthy and productive life. Families like yours, families like mine, and several families around us that we know.
Hi, I'm Patty Robb, and I'm the Executive Director of the Thomas and Warner Center, and we're happy to have hosted the Mental Health Services Board and their kickoff for their levy. We really appreciate the Mental Health Board. They do a lot for us.
So I'm really blessed to be the manager for the Issue 3 campaign that's on the ballot this year. It's a renewal levy, and what's exciting about it is that you can get the community involved in it. We get a great deal of community support, and a lot of people go out and tell the story of why this service and these services are so important. And the board has had traditionally great support from the Lucas County taxpayers. I'm really proud to work and make these things make this happen. I would just encourage everybody to make it out to vote whenever we have the primary, probably May 3rd, and make sure we can keep providing the support to the community and its members and its families that we need.